Ladies and gentlemen, we're going to be starting shortly. Just before we go live, just a quick reminder for those who've just joined us in the room. We are in a live broadcasting environment. And so if I can kindly request that we are as stationary as possible with limited movements during the broadcast. We're going to be live for 80 minutes. Might I also request that if your phone is on, which we would love for it to be on, that you kindly please just make sure that it's on silent, and even better that it's not on vibrate either, so that we can limit the noise spillover in any way or form. I think we are about 20 seconds out of broadcast, so as soon as I have every bum in seat, on the newly released report from the Global Council on Inequality, AIDS, and Pandemics. We're coming to you live from the Gordon Institute of Business Science in Johannesburg, South Africa. My name is Nozipho Shabalala, and it is an absolute privilege to be serving you as your host over the next 80 minutes. Now, this report, which is convened by UNAIDS and produced by the Global Council, has pulled together some of the world's leading economists, public health experts, and political leaders, and is being released just ahead of South Africa hosting its G20 summit here in Johannesburg. The title of the report is Breaking the Inequality Pandemic Cycle, Building True Health Security in a Global Age. Now, over the next few minutes, we're going to be hearing from members of the Global Council themselves as they talk to us about the intent of the report, but more importantly, some of the practical insights and findings around the possible pathways to true health security that are available for governments to take. We're also going to be listening into the voices that are coming from national health leaders on lessons that they have shared or can share on their efforts to break the inequality pandemic cycle. Now, I think we'd all agree that this conversation would be incomplete without the voices of community leaders who, using community-led approaches, are going to talk to us about the necessary resilience and how they build it in societies in and post-pandemic, especially when inequality is a key feature of that society. Before we get into the conversation, I don't want us to miss the timeliness of this report ahead of the G20. Of course, this brings us to ask the question, how is South Africa advancing health security as part of her presidency and chair of the G20? We'd love for all of you joining us in the room here in Johannesburg and thousands of you joining us online to please amplify this conversation. The hashtag that we're using is hashtag inequality pandemic. That's hashtag inequality pandemic. What we want to hear your reactions, your comments, your insights, and even your questions as you engage with some of these findings. And perhaps to kick us off, it's timely that I turn my attention to the Executive Director of UNAIDS and, of course, UN Under-Secretary General, that's Madame Winnie Binyama, as she maybe comes to talk to us a little bit about the inequality pandemic cycle. But, Madame, before I come to you, what we do know is that UNAIDS has convened the world's top experts from the fraternity of economics, from public health, those who are experts in understanding pandemics and inequality. And one can truly say this is a unique combination of leaders from politics, from academia, civil society, and beyond. And they make up this body that we're talking about, that we're calling the Global Council. Tell us a little bit about what is the inequality pandemic cycle that they're wanting us to break.
Thank you, Nozipho. The idea of the council emerged from us trying to understand the challenges we are facing with pandemics. We're in a world of pandemics, one after the other. There's so much innovation in science. We have complex systems for detecting outbreaks, for tracking pandemics as they grow, but yet we have one pandemic after another. So we wanted to understand, why is this, in spite of all the science that we have? So we saw that even though we are making progress in some areas, that the fact that we are likely to have a next pandemic in the next 10 years there's a real chance, made us think this is urgent for us to
Mm.
see what we need to do. So the council spent 2 years looking at existing research, doing new research, tracking to see the relationship between inequality and pandemics. And we found that within countries and between countries,
Mm.
inequality makes us more vulnerable to disease outbreaks becoming pandemics. Within countries, there are social determinants of pandemics.
Sure.
Professor Michael Marmot, who will be online, will tell us more about that. And then between countries, there are inequalities in access to resources, like inequality in access to finance. Joe will speak about that. He's an expert on that. Monica, who's also online, will speak about inequality in access to medicines.
Mm.
Those are key inequalities that drive pandemics. Where these inequalities are biggest, where the most unequal are within their countries and between countries, that is where we see diseases festering and staying. So pandemics, the inequalities drive pandemics, prolong them, make them more deadly, and make them more economically disruptive. And when that happens, then those countries and those most unequal people, then we see inequality continuing to increase. That is the cycle. The council developed recommendations on how to address these. First, in the area of finance, addressing the financial barriers that exist, particularly for a region like this one, addressing the debt crisis that stops the investments that are necessary. Secondly, to address the social determinants through which, if you address them, you build the resistance to pandemics, such as housing, social protection, and others. And third, that during pandemics, ensuring that the new medicines that come, the new technologies, are treated like global public goods and that there is access to them. So the importance of regional production of these medicines. And fourth, to build responses when there's a pandemic, to build a response that includes all the sectors that you need, not just the health sector.
Right.
The finance people, the social protection people, the human rights people, and to put communities at the center of these responses because they reach the last person. So those are the 4 areas where the recommendations are. So today, through the launch of this report, the council hopes to reach a huge audience out there of policymakers and others to focus on breaking this cycle of pandemics, inequalities that keeps us trapped in this era of pandemics. We can stop it.
Madam, it's a powerful way of framing the why and the intent and why we're here, and quite refreshing to hear such a crystallized sharing on the 4 things that we need to be focusing on: finance and financing barriers and the debt crisis in particular, which we're going to double tap on now, the social determinants, treating new medicine as a public good, but also the importance of a multi-sectorial sectorial approach. Let's double click on that now as I turn to yourself, Mr. Joe Stiglitz, because we talk about, and the council report calls for debt restructuring, which Madame has just spoken about, and it also calls for a new pandemic financing facility in particular. Why are these financing issues so important as we think about our preparedness for future pandemics?
What really picks up from what was just said about this vicious cycle.
Sure.
If you don't have resources, first, you can't provide the medicines you need to prevent the disease from spreading. Yeah. That's obvious. But equally important, and this is where our work comes in, particularly, is that if you don't have, if you don't have the resources, you can't prevent the increase in inequality. Sure. That's inevitably associated with the pandemic. You saw that so clearly in COVID-19. The people that were most adversely hit were the poor. And that's the vicious cycle. You have more people who are poor, who are deprived. That provides an opportunity for the disease to fester. The disease is worse. Then that makes the economic impact worse, and especially on the poor. And so this vicious cycle gets reinforced. And so, so the key to our analysis is to recognize this vicious cycle and to intervene. And intervention means that you have to both direct your resources at making sure that the disease gets broken everywhere.
Yeah.
And that requires, in turn, that you have resources. And this is where the debt comes in. The debt uses up a very large fraction of fiscal space. In sub-Saharan Africa, I think the number was something like over 60% of tax revenues on average go to servicing the debt. And that just means less money is left over to both provide medicines to address the disease directly, but also to stop the growth of inequality. In the contrast, what happened in COVID-19, massive amounts of money, amounting to 20 to 30% of GDP, went into keeping the economies afloat in the advanced countries. And it was about 4% in the developing countries, 4% of a very small number.
Yeah.
So you compare that 4% of a very small number was a very little stimulus. 30% of a big number was a very big stimulus. So inequality could grow a lot more in developing countries.
Yeah.
So that reinvigorates that cycle. Now, just a couple more points. How you respond to that inequality, to that lack of fiscal space, is also important. And one of the things that we emphasize in the report is don't respond by austerity. And that's been the mode of response recommended by some of the international financial institutions. And austerity is typically accompanied by policies that particularly hit the poor.
Yeah.
So austerity then exacerbates the inequality generating effect and doubles down on the cycle. And then finally, let me just remark, we've talked a little bit about the role, this vicious cycle within a country. Pandemics, by their definition, are cross boundaries. And the important point I always emphasize is that, viruses, these pathogens, don't know anything about the national boundaries. They don't carry passports. They don't ask for visas before they cross the border. And if there is some place in the world with a lot of inequality and a lot of space for the pathogen to fester, it will mutate. And it will then not stay in that country. It will go global. And we saw that so dramatically in the COVID-19. One of the things that I said and others said during COVID-19, it was not in the interest of advanced countries to have vaccine apartheid. It was in their interest to have the disease be affected globally to make sure nowhere in the world was the disease festering. But they didn't do that.
Yeah.
So one of the things that we called for, as Winnie said, was in terms of vaccine preparedness. And let me say, it's very clear we will have another pandemic. We don't know when, but the probability is just very, very high, that we ought to be better prepared. We should have learned the lessons from each of the pandemics we have, from Ebola, from HIV,
Yeah.
from COVID-19, and I'm afraid we haven't. But two of the important lessons is, let's have money on the ready. Let's not wait and scramble. We know it's going to happen. Let's just say, let's create reserve funds. The moment the WHO says there's a pandemic, those monies are released. And the second thing is, let's say that, make sure that we have the ability to produce the vaccines in every part of the world, so we don't get vaccine apartheid. And let's make sure that we have a vaccine waiver, so that, and not just vaccines, all the pandemic related products, to testing, to therapeutics, so that we don't have to go through the agony that we went through in COVID-19, where we failed. Let's be clear, we failed. And we know how long it took, and we don't want to say, let's negotiate until the pandemic is over, which is the strategy last time. So these are things that we, in our report, we sort of differentiate. What are the things you need to do in the pandemic, and what are the things you need to do in preparedness for the pandemic that is inevitable? And what I try to lay out are the kinds of things that we need to do on both fronts.
That's absolutely fantastic, Joe, because what it does is that it brings history back into the room. And what I'm hearing you say is there's so many lessons about what we should have done differently that have come from previous pandemics. And here's an opportunity to now map these as pathways to do things differently. As you talk about policies that actually are pro-poor in the midst of a pandemic, that requires quite a significant shift from what we saw as a response from governments in the prior pandemics. But you talk about the ability to produce locally and to potentially have waivers. And what that does is that it takes me to my next conversation point, because I want to build with that with the chairperson of the One Economy Foundation and former First Lady of Namibia, who joins us on the screen now, Madam Monica Gengos. I know that you are online with us, and we want to just make sure that we've got you. Thank you very much for joining us. I want to build on this point that Prof. Stiglitz makes, and to ask you the question, why are local and regional production so important? And in particular, I know you're very passionate about talking about the sharing of important technology as we build that muscle of preparedness for pandemics. Over to you, Madam.
So Joe talked a lot about, first, good afternoon, Nozipo, and to the two Joes and everybody else in the room, and Winnie as well. What Joe talked about was a lot about the inequality within countries, and the issue about vaccine production and local production, to be specific, really goes to the heart of inequality between countries in access to medicines, which make the world more vulnerable to pandemics. What Joe called that vicious cycle of inequality worsening pandemics, and then pandemics worsening inequality. And the reality is that when only some countries can respond effectively to an outbreak, and others lack the means to do so, it makes everybody across the world more vulnerable. Inequality is good for nobody. And the real tragedy is that breakthrough medicines and technologies for HIV, COVID-19, and mpox are not reaching the vulnerable populations quickly enough. And this prolongs inequities in access to optimal care and prevention. We saw this during the AIDS pandemic, and we saw this happen again during the COVID-19 pandemic. And what we saw, Nozipo, was the slow rollout of antiretroviral medicines to low-income countries in the 1990s and 2000s caused millions of preventable deaths from AIDS. We also saw 6 months after COVID-19, the vaccines had received approvals in high-income countries that had 90% of what they needed to cover priority populations, while low-income countries received only enough to cover 12% of their priority populations. And Nozipo, this wasn't just about money. There were countries like Namibia who had the money to buy vaccines, but didn't have the access. So it went further just than the low-income countries not being able to afford the vaccines. Another thing we saw today we now have revolutionary long-acting medicines for HIV that are available and which can absolutely transform the HIV response. But many low and middle income countries have little to no access to this breakthrough technology. And in Namibia, where I'm from, this could be an absolute game changer for our young women who are at risk of HIV. So we're at an awkward place where breakthroughs in science and technology have still been met by a failure to share technology across borders in pandemics. And it really is a failure. And these failures result in people dying preventable deaths. The intellectual property barriers and the insufficient manufacturing capacity together continue to mean that the supply of pandemic technologies continues to be insufficient to the needs of those who need them the most. And what the report is saying, Nozipo, is that world leaders really need to look at increasing global funding for regional production. And this will create the pull mechanism for technology transfer. And Brazil has already proposed a global coalition that we support. And the international financial institutions like the World Bank should support and enable that coalition to address the pandemics of today, like AIDS and TB, so that we prepare for those of tomorrow. The second is that we should automatically waive global intellectual property rules on pandemic technology when a pandemic is declared by WHO. The third is we need to build a R&D model that treats pandemic health technology as public goods. My friend Joe Stiglitz just mentioned, and he's been saying, and the report says as well, the report proposes that instead of patents, the major funders should give prizes for pandemics. So we reward innovation, but also allow them to be made in factories in Africa, in Asia, in Latin America. So that's really what that part of the report is saying.
Madam, thank you very much. And if you're joining us online, I really hope that you are sharing and tweeting on every social media platform prizes over patents. That is certainly a really powerful way of framing the opportunity here. But before I go to our next guest, it's striking to me that, Joe, you mentioned this idea that pandemics don't carry passports. They do not acknowledge any borders. And yet we hear from Madame Gengos that somehow there's a consideration for borders when we now start thinking about the sharing of technology and the waiving of rights around IP. And so it's a really interesting tension and contradiction that's been raised in this conversation. Access to technology, a failure to share that technology, but also manufacturing capacity at a regional level being some of the things that are just being highlighted. I want to go to the Institute of Health Equity at University College London as we bring Professor Sir Michael Momot into the conversation, who I also know has some very interesting views on the question of social determinants that Madame Vinyama, you had raised earlier. Michael, let me bring this question to you. Why are the factors outside the health system, those that we refer to collectively as the social determinants, why are they so important to addressing pandemics and to our preparedness for future pandemics?
Well, let's go back to the beginning of COVID. When the outbreak happened, there was a myth, a convenient myth, that we're all equally susceptible. And that was a myth. The idea that prince and pauper alike would be liable to get the infection. We're all susceptible, but not equally so. What the pandemic revealed was huge inequalities, not just that the poor were more likely to get COVID, but the poorer you were, the more likely you were to get COVID, a social gradient. And that social gradient looked very similar to the social gradient in health pre-pandemic. And we know that those inequalities in health in non-pandemic times are not simply due to lack of access to health care, important as that is, but to the social determinants of health, the conditions in which people are born, grow, live, work, and age, and the kind of economic inequalities that Joe Stiglitz was talking about, the global inequalities, they drive those inequalities within countries. Austerity particularly, if austerity means that you stop investing in social programs, that lack of investment affects people differentially. The poorer they are, the more they're affected by that lack of investment. And the evidence shows very clearly that countries that are more unequal have higher risk of HIV, higher risk of AIDS, higher risk of COVID infection and mortality. It means that when we talk about the social determinants of health, we're also talking about the social determinants of pandemics. If you're concerned to prepare for a pandemic, you can't say, oh, well, we've just got to make sure we've got virus control and testing in place. Yes, you need to do all those things, but you need to be investing in the social determinants of pandemics. And then the pandemic comes, and this is the inequality cycle. Then the pandemic comes. We know, for example, and we point this out in our report, that during COVID-19, the increase in global poverty was something like 165 million people were pushed into poverty globally, while the world's richest people increased their wealth by more than a quarter. Billionaires had a very good pandemic. They did really well. There was an increase in billionaires and an increase in their wealth, while poorer people got poorer. So you had the pandemic increasing these social and economic inequalities, which means that we're less well prepared for the next pandemic unless we act on the conditions in which people are born, grow, live, work, and age, and the fundamental drivers of those inequalities.
Sure, Michael, I think, again, these are more than just sound bites, but such important policy provocations, if I may call it that. Prince and pauper could all be infected, but not equally. The more poorer you are, the more likely you are to be infected. And then perhaps my favorite line so far, billionaires had a good pandemic. I haven't heard that line, and I think it's a really interesting way to put the provocation in the room. Now, before I transition to the lessons from some of the national health leaders that are with us in the room today, I think it's important just to take a moment to reflect on what we've just heard. We've heard the importance of focusing on financing barriers and the debt crisis. We've heard about the social determinants from Michael. We've heard about the ability to produce locally and regionally. We've heard about the importance of a multi-sector approach, the bravery and the courage to move away from an austerity response in the face of a pandemic and to rather double down on investing in people and in communities. And that perhaps we need to reimagine how we think about intellectual property and intellectual property rights as we think about how do we get more innovative solutions to the surface. I turn now to the Deputy Minister of Health here in South Africa. As you can see, I have a lot of Joes on the stage, but this one is Joe Opatla. Honorable Minister, as I come to you and we bring the South African experience into the room, how has inequality impacted pandemics in South Africa? And maybe I should say, how have inequalities, because we know that these are multifaceted and different in many ways. And the most important part of the question is, what has proven to be effective as an approach in addressing this?
Well, thank you very much. Thanks, Nosipho. Indeed, South Africa, we can say that was a microcosm of the report in terms of showing the impact of inequalities in our experience in dealing with these pandemics. Let me just start with what the previous speakers have mentioned about COVID, the experience of COVID-19 in our country. First of all, just the issue of access to diagnosis.
Yes.
When I'm sure many of us have forgotten how difficult it was to access just testing. And those who didn't have medical aids, would die without even knowing in the beginning that they had COVID, because it was largely the private laboratories which had the capacity. Of course, we had to quickly build the public health laboratories' ability to make sure that in all our public health facilities, we can be able to even just get diagnosed. But of course, further on, The WHO guided all of us in terms of how to mitigate against the impact of COVID. Now, some of those looked easier said than done. First of all, just the issue of hand washing. We said you must wash your hands regularly, even showed us how to do the washing. But of course, for somebody who hardly has water to drink,
Yeah.
when you say after, this and that, wash your hands and this is how you do it, when you hardly have water to drink. I mean, but we have to come in and move in, make sure that in a number of areas start delivering water, drilling boreholes, and those kind of interventions, which were temporary, but it says to us that we need to make sure what Michael spoke about, the social determinants, making sure that people have access to clean water. Secondly, just as further examples, we talked about part of the guidance was social distancing.
Yes.
We started with 2 meters, stay 2 meters from the next person, and so on. Now, it might be easy, I mean, when you live in a mansion or in a bigger house, but when you live with 20 people in a 4-room house, in a small informal settlement, how do you social distance? Of course, then came the lockdowns, stay at home, but stay at home social distancing. So these are some of the challenges which said we need to accelerate provision of housing, which Michael spoke about. Of course, another big issue, especially as Prof. Michael spoke about, the issue of income, especially with the lockdowns. The people who had secure businesses and big positions could sustain themselves. But people who survived on day-to-day income from selling goods on the streets were devastated. Of course, we did come with interventions in terms of social relief, food parcels, and also cash transfers, thanks to COVID indirectly, because here in South Africa, we sustain that cash transfer, small as it is, but it makes a lot of difference. Coming to HIV and AIDS also as an experience, also with TB, I can just mention some of the driving forces of inequality in access to health systems. Of course, again there, when the HIV treatment started in the early 2000s, some people who are here will remember, it was only those who had access to private health who could access treatment. We have changed that now by rolling out universal access to HIV treatment. Also, again, poverty increases vulnerability in terms of access to not just the medicines, but to go to the clinic and so on, you must travel. Of course, we're dealing with that, making sure that people can get medicine delivered next to their homes. Gender inequality also, the poorer, I mean, as you said, young women and girls are very vulnerable. It's even worse if you're from a lower socioeconomic, because then issues like, sex work comes in for a living, and that just drives, again, the vulnerability. I think I've already, even on spatial inequality, especially more on TB. I mean, we say that for you to avoid getting TB, you need good ventilation. Of course, that depends on your income. Of course, the stigma also in as far as HIV and TB are concerned, those also largely in the lower income areas. Those are the things which we have to deal with. A lot of work is being done, mobilizing society to make sure that we can deal with issues of stigma. So there has been interventions, as I've mentioned, strengthening the public health system has made sure that we're still on course. I think Minister Mutsareid will speak more about the NHI intervention to make sure that we can accelerate universal access. So those are the interventions which we are working on against a lot of resistance. Access also to universal test and treat, that also has in a way brought some equalization. So there are a number of areas, mobilizing communities, making sure under the South African National AIDS Council, making sure that ordinary communities, civil society is involved in education, but also in terms of mobilizing people to get treated, to get tested and treated. So indeed, those are a number of lessons, very practical for us, and which we are hoping that this report, which will be taken seriously by policymakers, will help us to make sure that future and even current pandemics like HIV, to bring it to an end as a public health threat, we need to make sure that we reduce these inequalities. Thank you very much.
Deputy Minister, I think that's really, really insightful contribution that speaks to a responsive policy mindset. The idea that perhaps there are gaps in how policy is formulated relative to the lived experience, how you bring in the reality of perhaps a person who lives in a one-room house or in a township that can't adhere to some of the policy restrictions in response to a pandemic is quite important. And I think what's really also exciting as we listen to you is the different reconfigurations of how do we then, with our own reality, begin to close these gaps. I want to build on the South African experience. I want to go to a country that's not too different from South Africa, also part of the global South, and that is to go to the voice of the former Minister of Health from Brazil, Madame Nícia Trindade, who also joins us online now. Madame, let's bring Brazil into focus because, like South Africa, Brazil has the challenge of a relatively high inequality. The question to you is, how has that affected pandemics in Brazil? And what is the key lesson that you can share with us from that experience at this point?
Oh, thank you very much. It's very important to be here now and to think together, my colleagues of the Global Council. Thank you very much for the question. First, I'd like to put, I think that the key dimension and the key point for us is that economy should be considered beside the social policies. And Brazil has a universal health system and a history of good social policies in health, like programs for prevent and the treatments of HIV/AIDS and the others. And in spite of this, Brazil had one of the most dramatic results in terms of facing COVID-19 pandemic. So I think that there is a political dimension to be considered, and this we face this in terms of the process of dismantling social policies. One thing that has been evaluated in many studies. So that's my first point. Brazil has 2.7 of the global population in the world and has something like 11% of the number of deaths. So it's not, it's a very dramatic point. In terms of the inequalities, so that is a historical problem, as you had mentioned. We have many researchers that are facing this point. So we can see that we have to consider together historical inequality and the role of public policies. That's my point. Some studies, especially at the national survey for the real, for evaluate, assess the real dimension of COVID-19 pandemic, show many problems related to poor areas in Brazil, the facing gender inequality, indigenous people as the most vulnerable in the facing COVID-19 pandemic, and as well, we can put the problem of marginalized groups, poor, Black, indigenous, and the peripheral communities experience severe income loss and food insecurity. So I think that a health emergency overlapped with an economic downturn, increasing poverty rates. Pandemic effects varied by class, race, gender, territory, and age. Women faced disproportionate burdens, including job loss and increasing caregiving responsibilities. So, how could you think about lessons? I used to say, like the sociologist Klaus Eder, that we can have lessons, but the world is very difficult to change. Think about this. Since 1923, we try, and that is a position of Brazilian government, to facing these inequalities in national, local, because we have a lot of regional inequalities in Brazil. The North especially suffer very much with COVID-19 pandemic. And so the idea in Brazil is to improve programs like Bolsa Família and income transference program, but besides this, reinforce social policies as a whole: education, health, the Brazilian health system, SUS, and housing programs, and so on. And the idea is at the same time to think in the national level to reinforce the local and national production in Brazil. We have the capacity of production, but it should be reinforced. And at the same time, Brazil, I think that has a position to put this kind of position in global forums.
Yes.
So before addressing inequalities, it's important to say that Brazil is proposing in G20, BRICS, and COP30 that is starting this week, proposals very, very close to the Global Council's recommendation agenda. One is the Global Alliance Against Hunger, and the second, this Coalition for Innovation and Local Production, as Monica and Joe and many other colleagues here had mentioned. So
Yes.
I think that thinking about national and the global dimension.
Madam, I think that's a really, really helpful contribution. Thank you very much, because it's the first time where we hear a targeted view on the idea of the gender lens as we think about those responses to the pandemics, but also beginning to highlight the experience of marginalized populations, indigenous people, as an example. And I think when we get to the community voices, which we're going to be turning to shortly, we're going to be able to double click on some of those insights that you've shared with us. It reinforces again the multi-sectorial approach, but also this very important statement that is made that lessons are important, but lessons on their own don't bring about change, and that we actually have to really think about how do we change outcomes and actually use those lessons effectively. Madam, thank you very much. So from Brazil, we make our way to Spain now before we then turn our focus to the voice of the communities. And in Spain, we're joined by the Secretary of State for Health, Javier Padilla Bernaldez. Thank you very much for joining us. And again, the question is somewhat similar, and that is, how is Spain working to break the inequality pandemic cycle? But to the point that Madame Trindade just made, how is Spain doing that both with the domestic lens and a global lens all at the same time?
Well, thank you very much. First of all, is to say that here in Spain, we try to make a coherent response and preparedness between the domestic policies and the international policies. So on the hand of the domestic actions, first of all, to say that the three pillars where we are building on them our actions here are the social cohesion, the universal health coverage, and the community engagement. So in my opinion, in our opinion, the main action that we should be taking in order to break the inequality pandemic cycle should be centered in guaranteeing the labor rights and the labor protection. So we have been seeing that during the COVID pandemic, the high degree of labor protection made us possible to take some actions and some interventions that if we only had let's protect the working class, there should be much more difficult to be able to do them. The second one is focusing on universal health coverage. We are recovering the full universal health coverage in our country, but also we try to focus on universal coverage on the social determinants of health. So trying to guarantee the electricity, the water supplies, the housing, or everything related to how to guarantee the social determinants of health is also a very core action in order to guarantee to break the inequality pandemic cycle. The third thing would be about how to strengthen our public health structure. So we are creating our national public health agency with the social determinants of health view, and also creating structures together with other institutions in order to make a response more global. And I would like at a domestic level to state that we are not talking about past pandemics or future pandemics. We are also talking about current pandemics such as HIV response. And in HIV response, we are working very closely with the community. So we are strengthening the community engagement in order to make us able to promote or to program future actions when things are coming. So we are fighting a stigma together with the communities to arrive in a more direct way to address vulnerable people. And at an international level, I think that our main focus is to support every tool which can increase the autonomy in the low and middle income countries. We are working together, especially with PAHO, to coordinate the increase on the production's capacities in order to increase the local and regional production capacities, and also at a very global level to be very respectful and to promote the use of the TRIPS waivers when the pandemics are arriving. I think that the TRIPS waivers and other possible waivers that can be put on the debate are the possibility of overcoming the debate and the dilemma between patients and patents. And to finish, I think that there are a couple of more things. First of all, is integrating global health in our research and development agenda, in our R&D portfolio. And the other thing is support multilateralism and defend the mechanisms such as the pandemic agreement as a necessary, not perfect, but necessary tool for preparedness and response.
Javier, thank you very much. And you've brought into the conversation yet another fresh perspective, the importance of labor rights and the protection of labor rights. We will be talking about universal coverage with the Minister of Health here in South Africa very shortly, but also some interesting thoughts around integrating global health within the country's research and development architecture. As you spoke about reimagining the structure of healthcare, one of course, we're starting to think not only about the infrastructure, but perhaps the governance structures as well, and the ability to reach local communities effectively. So thank you very much. And I think one of the things you've also brought to the fore is that while we might be drawing from history and throwing forward to the future, that we don't lose sight of the present challenges that are still pandemics that are alive even today. And your example of still fighting stigma around HIV and AIDS is one that I think stands loud and clear in the room for all of us. I think it's time for us now to shift gears a little bit and go to the coalface and speak to some of the people who are in the communities where they are potentially in communities that have a high feature of inequality, and communities that are trying to build the necessary resilience in pandemics and post-pandemics as well. And so I turn my attention now to Uganda, where I'm inviting the Director General of the Key Populations Consortium, Richard Lusimbo, who also joins us now now. Richard, welcome. And really what I want to do is to get to the core of the conversation with you by asking, how does marginalization, which we've heard being referenced by some of the speakers here today, how does marginalization of different communities affect pandemic responses, and how can community-led approaches help us to begin to be a lot more inclusive in how we respond to pandemics? Over to you, please, Richard.
Yeah, no, thank you so much for that question. And I also once again want to congratulate and thank my colleagues from the Global Council and our convener, we need Executive Director of UNAIDS. I must say from start off, from HIV to Ebola to COVID and now Mpox, we have seen that marginalization determines who survives, who suffers, but also who is seen. Pandemics mirror the hierarchies in our societies, as many of the speakers have already spoken, and also when entire communities are left on the margins, response systems become weaker, slower, and less just. To really speak to this question in this conversation, I'll speak on around 4 things. And the first is being inequality as a pandemic multiplier. Pandemics thrive where inequalities exist. Key populations that include LGBT, sex workers, people who inject and use girls, people who inject and use drugs, women and girls, and my colleague will speak more about women and girls, but also looking at the migrants, the Black community, the queer communities often live at the intersection of exclusion. They are denied access to health, protection, but also social support. These overlapping forms of discrimination don't just make people vulnerable, they block the pathways, prevention, and recovery. When laws criminalize identity, when poverty dictates choices, but also when public health messaging ignores the community realities, the virus wins. We saw this during COVID-19 lockdowns, treatment disruptions, increased violence, but also lost livelihood hit marginalized groups the hardest. The same pattern emerged during Mpox pandemic. Stigma silenced those most affected, leading to delayed detection, but also slow response. My second point here would be how marginalization undermines response systems. Marginalization doesn't exist in theory. It is visible in data gaps, policy blind spots, and human stories. Criminalization and stigma drive people underground and away from services. Economic exclusion forces communities to choose between survival and safety. And I really liked what Deputy Minister said, around survival. And I'm so glad that a country like South Africa was able to do the money transfers. And I think we've seen some other countries that have, and this is really important. But also we're looking at information inequality that fuels mistrust. When responses are top down, people disengage. But we're also looking at resource allocation often, overlooking community clinics, informal networks, but also the rural collectives that serve the hard to reach communities. And when communities are excluded from design and decision making, data becomes distorted and coverage becomes inequitable. You can't manage what you refuse to measure, and we have denied for too long to count the invisible. My third point will be looking at community-led approaches and how they work. In Uganda and across the continent, community-led systems are not a luxury, they are life-saving infrastructure. Community-led approaches succeeded because they build trust, speak to the local language of care, and turn lived experiences into leadership. They don't wait for permission. They respond with compassion and context. When communities lead, people participate not as beneficiaries, but as co-designers of the response. That shift changes everything. Tech improves, stigma decreases, but also accountability strengthens. And my last point, from engagement to power sharing. To be clear, we don't need more community consultations. We need community power sharing. This means funding communities directly, not as subcontractors, but as equal mentors and decision makers. It means recognizing that lived experiences other expertise, and that resilience is built from the ground up and not top down. As the UNAIDS Global Council on Equality, AIDS, and Pandemics reminds us, communities are not beneficiaries of response, they are the backbone of it. And as I conclude, if we are serious about ending pandemics, then we must be serious about ending inequities. A world that marginalizes cannot protect, but a world that listens, that invests and trusts in its communities, can protect and prevent, can respond, and also can heal. The pathway forward is not only medical, it's moral. We must shift from responding communities to responding with communities. Equity is both the means and the end, and community power is the bridge between the two. Thank you very much.
Richard, you're getting a round of applause here in Johannesburg. I do want to let you know. A lot of noddings to that contribution. And of course, all the elderly people are clapping and the young people are doing this because apparently this is what you do now when something has been absolutely phenomenal. But let me say this, two things. Pandemics mirror a society. And you've spoken about what that mirror is showing us and how, if we want to look closely to see what the mirror is saying, we look at just the data gaps, we look to the policy blind spots. Communities don't need more community consultations. What they're looking for is power sharing. That's Richard Lusimbo in Uganda. I come back now to the room and I turn my attention to an HIV youth activist here from South Africa. Her name is Nomonde Ngema. Nomonde, as I bring you into this conversation, one of the things that Richard alluded to is that you would speak to the importance of empowerment of young women and how that in itself helps in how we respond to pandemics. What are your thoughts?
Thank you, Nosy. If I do look nervous, it's because the coffee hasn't kicked in yet. Thank you so much for that question. So, I mean, I think it's clear that when pandemics do hit, it's not only just inequalities that surface, but it shows societies who matters, and it shows, the people that are, people already affected, right? And it kind of makes them feel like, oh, this world is not for people like me. This world is only for people who are privileged. And so that's exactly what happened when, COVID-19 happened. I just want to, in my conversation, I'll just interconnect it with COVID-19 and, living with HIV, et cetera, et cetera. So as a young woman living with HIV, I know that that's not only my story, right? Because I experienced COVID-19, but long before I was born, HIV happened, which was quite a shock, right? But we're here now, there's great progress, and people invested money, and countries came together, and they stood together to say, man, this is something that we can, solve when we stand together, and this is how we save one another, when we stand together working to end this. So with, okay.
So tell us a little bit more around how you see the work of empowering young women. Why is that important?
No, I got it. It's the caffeine. So essentially, right, young women are already facing problems.
Yes.
Interconnecting problems that overlay, right? And so to be a woman is a big thing, and it can't be boxed into one policy because our inequalities follow us into our day-to-day lives, into school, boardrooms, clinics, everywhere. They follow us. When pandemics hit, those are reinforced. Women are already earning less. And when inequalities happen, when pandemics happen, women actually, as the caregivers, as the people, the hearts of the communities, they are affected most. And they already earn less, meaning that they have to use those fees to kind of mend for their families and communities. When pandemics hit, they don't have enough to survive. Like during COVID-19, women didn't have enough to survive as compared to men because already they're oppressed, already they're earning less. And another thing is that, young people in general, right? Young people are left out of decision making. And therefore, when difficulties and oppression comes and situations happen, the solutions don't necessarily reflect what people are going through. The most powerful make these decisions and they analyze and they make assumptions, which is okay because they are well advanced, right? But it's like they can be more responsive and inclusive if they include lived realities of people who are actually the most affected. So let's talk about Unolwazi. Unolwazi is a girl from a rural area who's living with HIV. And when COVID-19 happened, she, change happened. So she had to do online learning. She went back home. So luckily, her mom was an entrepreneur, right? And when that happened, she could still go on with her business. When that happened, she could still study from home. When that happened, she was still able to be a young person to continue with her academics. She could still dream. She was living with HIV. She could continue taking her treatment, right? So can we give a round of applause for Nolwazi's life?
Yes.
Or we can clock it. Only that did not happen. That story is made up because that's not what happened to most young people's realities. What happened was they lost their parents, and then they had to become the parents. During grade 11, they had to take care of their siblings. They had to drop out because now they are responsible for the household. They experienced treatment interruptions. Other health needs like SRHRs, sexual reproductive health services, were doomed as not that essential and important. But for a young woman, a young person who was in an abusive relationship, trapped in that was important. Prevention was important. For a young woman living with HIV, ARVs were important, but access at that time was very different. Because where are you going with taxis when we're suffering at home with COVID? Where are you? What's your business with the clinic on and off? And then stigma also amplified in communities. And what also pandemics did is that I didn't realize it until I was reflecting yesterday is how uncomfortable you become as a person who is already living with a disease. I was very uncomfortable during COVID-19 because I understood that it can happen to me anytime. I can wake up and I'm so they just kind of show us how we're always at the brink of things, right? And so what needs to happen is that going forward, young women need to be empowered. They need to continue with school so that they can have, financial independence, so they can make decisions that are good enough for them, right? Not decisions out of convenience. What needs to happen is that young people are involved. When these things happen, young people are engaged. What's going on? How are you affected? Unemployment skyrocketed. What happened to young people's voices? What were they saying during that time? And still now, I think there are a lot of stories that deserve to be audited from that impact as to now that what's still happening. I think those stories still matter. When the funding crisis started happening this year, I, as a young person living with HIV, got a lot of calls from, journalists and people who wanted to hear from my perspective. And although I was very honored, I understood that I was just living in Johannesburg. KwaDukuza, somewhere in some rural area in KZN, there was a young person who was affected more than I was. Because what I could say was, the question is, no wonder, do you still have access? Do young people still have access to ARVs? I would say, I have access to ARVs. I can't speak for other young people. Let's get all of them to audit their voices online. Create like a platform where young people can continue putting their stories of what's going on in their communities, because understand that government can't be everywhere. On the ground with people in their day-to-day lives. And so what really needs to happen is that there needs to be some sort of choosing of conviction instead of convenience, to understand that inequalities do affect us differently. We're not the same. I'm a young girl, a young boy, key population's different. Yes, they do have the same, they are the same medically, but they're not the same emotionally and socially. And also it's a systemic flaw that there are still children who are born with HIV in this day and age. When I was born with HIV in 2003. And it baffles my mind why this is still happening, right? This can't still be happening while there's so many methods that have been onboarded to ensure that this does not happen. So the roots of the problems are really multi-layered, and we really need people and our leaders to shift that focus into answering and having difficult conversations and ensuring that, young women are empowered, because I'm proof of what happens when women are empowered. You get to sit here and you have these important conversations, no matter how much your caffeine is taking time to kick in. But yeah, thank you.
I think that deserves a round of applause, wherever you may be in the world. And I can see we've got a few more people clocking it. Thank you very much. In the room, I see you. And therein is the importance of the lived experience. And therein is the importance of the unfiltered story of this is what it actually looks like. And in case you didn't hear that confrontation, you're choosing your convictions or you're choosing your convenience. And I just think that was such a gift that you've given all of us in the room. Now, Minister, I know you've been sitting quietly listening, and I'm going to ask you to sit quietly a little bit more, because as we begin to draw to a close, what I'm going to do is I'm going to circle back to some of the members of the Global Council. I'm going to give them an opportunity to give a 2-minute contribution around their thoughts around the South Africa's G20 presidency and this broader question of advancing real health security. And then I'll offer you the floor to give us some of your reflective and closing remarks. So let me go back to Joe Stiglitz. Let me come back to you and to say, as we think now, in this moment in time, which is quite significant for the continent, with South Africa chairing the G20, how do you regard South Africa's efforts in advancing this agenda that we've been speaking about?
Well, I'm very, very impressed. And let me say in two or three ways. First, I began my remarks talking about the importance of access to medicines.
Yes.
You can't address globally a pandemic without access to medicines everywhere. And I mentioned that South Africa was really in the forefront of that then, and has continued to be at forefront of that fight. And secondly, I talked about the importance of resources. You can't fight either the social determinants, the economic determinants, or the disease determinants if you don't have resources.
Yeah.
And one of the important elements on the South African agenda this year for the G20 is debt relief, figuring out how to deal with debt. And I just put, that very important. I chaired a commission that was, I was asked by the late Pope Francis, and we thought it was just, one of the major issues, and that's now being taken up, and that ball is being pushed in a very important way by South Africa. The third thing, we talked about the inequality pandemic cycle.
Yes.
One of the really important initiatives that the president has undertaken is this, what he calls Extraordinary Commission on Inequality, and trying to place on the agenda of the international community in a permanent way, to be a permanent legacy of South Africa, that there is an inequality emergency.
Yeah.
We should create an international panel on inequality, just like we have a IPCC to assess the dimensions of inequality, to formulate why is this happening, what are the consequences if we don't do something about it, and what are the policies that we might. We're presenting our report tomorrow to the president, and one of the important findings there is inequality is a choice. There are policies, many policies, and each country and the international community has to make a choice of those. But we were all convinced that there are multiple policies that could make a difference. So those are three examples on the international agenda where South Africa really has taken the leadership. And I think it will be a legacy. These will go on after. There's one other thing I wanted to mention is, talk is one thing and trying to do something is another. And South Africa is actually trying to do something here in South Africa. And I think that's really important, that at the same time he's trying to frame the global agenda.
Yeah.
He's trying to frame the national agenda, and not only agenda, actually doing something, and that's through the national insurance scheme. You know, in any of these initiatives, both at the global and the national level, there's going to be resistance.
Yeah.
And I just admire him so much for his determination to push back against those forces inside the government, outside the government, internationally. You know, any of us who've been in politics know, you know, I can give the most reasoned argument, and I think most of my arguments are very reasoned. And it would be very nice if everybody said, you know, you're right. My students always say I'm right. But in the global politics,
Yeah.
I'm surprised people disagree with me all the time. And it takes persistence,
Yeah.
and push, will to get any of these things done. And your president has shown that commitment that I think is going to get these things, as we say, expression in sports, get it over the line.
Get it over the line. Joseph Stiglitz, thank you so much, highlighting there the importance of what we put on the agenda, but also not only what we fight for globally, what we're actually doing nationally as well. Thank you very much. I want to make my way back to Michael Marmot now, back at the University College London. And Michael, again, we're beginning to wrap up, and quite tightly at that, and would love to just hear in 2 minutes from you, what's your appeal to the G20 leaders that are going to be descending on Johannesburg, South Africa in the next week or so?
When we published the report of the WHO Commission on Social Determinants of Health, we said on the cover, social injustice is killing people on a grand scale. Does anyone think we've solved that problem? Social injustice is killing people on a grand scale. And part of that, of course, is exactly what Joe Stiglitz is talking about, inequality. The Pew Research Center has surveyed people in sub-Saharan Africa, in Asia, in Latin America, in North America, in Europe. The overwhelming problem is inequality. And a majority of people in countries in all those regions say something has to be done about the economic system that generates that social and economic inequality. I'm a health person, and I'm concerned with the health consequences of that. If you walk into the house of the British Medical Association in London, you see the slogan, with head and heart and hand. Let me apply that to our problem and the Council's report. The head, we know what to do. The evidence is there. I would like the G20 leaders to look at the evidence that we've compiled and apply their hands. We know how to do it. The evidence shows us what needs to be done, and that's what Joe is talking about. But what about the heart? Do we have a commitment to social justice? I would like, it shows how naive I am, that I think evidence is important. I think democracy is important. People's opinions are important. And, dare I say it, at the heart of all of this is the question of social justice.
Michael Marmot, thank you so much. At the heart of all of it is the question of social justice. How will the G20 leaders show up not only with their head, but also with their hands and with their commitment, which is a reflection of their hearts? What a powerful contribution there. I want to go back to Namibia now as I call on Madam Monica Gengos once again. Madam, the question to you again in 2 minutes, if you can. Are you hopeful when you consider South Africa's presidency of the G20 and the agenda that South Africa has set, and whether that can succeed?
Yes, I'm absolutely hopeful. And it comes from what both my co-chairs have said. Joe talks about inequality being a policy choice, and Michael talks about what this report does is tell us exactly what is the issue and what needs to be done. So I'm absolutely hopeful. The inequalities that drive pandemics and pandemics worsening inequality cycles, it can and it must be interrupted. And we do have the ingredients, starting, Nozipo, with what you're talking about. Firstly, we have the leadership from South Africa as chair of the G20, leadership that has been exceptionally exercised. And we also have leadership from other countries. And we also have the leadership from civil society across the world. You heard Richard talking about communities matter. We cannot make decisions without community. We also have the evidence of what needs to be done, which is set out in this Breaking the Inequality Pandemic Cycle report. So this gives me hope. And we've shown that the actions needed to break the cycle are in the interest of everyone. So the Breaking the Inequality Pandemic Cycle is not only the right thing to do, it's really the smart thing to do. Thank you.
It's not the right thing to do, not just the right thing to do, it's the smart thing to do. And we have every single ingredient that we need in the pot. We've got leadership, we've got community, and we've got evidence. That is Monica Gengos. Madam Binyama, I'd come back to you now. What's your final message before we hear from Minister Motsoaledi? What's your final message to everyone here today, to the many who are joining us watching this live stream, to those in the room, but also to the many who are going to be consuming this broadcast ahead of the G20?
Thank you. Like our co-chairs have said, we can't break the inequality pandemic cycle. We know what we need to do. Within countries, it is the most unequal people who are at the greatest risk of a pandemic. How we tackle inequalities within countries will in large part define how resilient that country is, how it can prepare, prevent, and respond to a pandemic. That is why I add my voice to Joel to say that universal health coverage, such as here in South Africa, the national health insurance, is key. That everyone has access to a decent package of health services. That is key. Countries that didn't have it, we saw what happened during COVID. So are publicly funded health systems, education systems, so are labor laws that guarantee fair wages to workers, so are social protection systems. You need all of that. And then internationally, and that's why we came here to South Africa to launch this report here, as 20 richest countries are meeting. We must address the structural barriers in the global economy that keep countries trapped in debt, such as our countries here in Africa, cycles and cycles of debt. We need to address that question of equitable access to finance. And the countries that will come here, the governments that are coming here, we have the solutions. They're in the report. They're in the report that Joe has mentioned that's going to be launched tomorrow by President Ramaphosa. It's the will to address those financial barriers. Then the barriers to medicine, the intellectual property barriers, that too. The countries that, the governments that are going to meet here can take the steps to make sure that next time we have a pandemic, we will not have vaccine apartheid. It's President Cyril Ramaphosa who gave us that word, vaccine apartheid. It must not happen again. And they have the power to address that through taking the steps to change intellectual property laws so that you at least can waive the intellectual property rules and have access to new technologies that are needed when there's a pandemic. So we know what to do. Some of it lies within our countries' national policies, and some of it lies in the international space. And that's why G20 is so important for us. I want to take opportunity to thank very much Georgetown University, represented by Professor Matthew Kavanagh sitting over there. It is with them and us UNAIDS that we were able to bring together these great minds and leaders to write this report. Thank you.
Madam, thank you very much. And again, the message being a re-emphasis on action. on unlocking and activating the will to act, to choose. We've heard repeatedly today that inequality is a choice. What is it that we're going to choose? And back to Nomonde's point, what are we choosing in terms of what we're convicted about versus what we want to live as a convenience? Madam, thank you very much. Now, Minister, thank you very much for your listening posture throughout this conversation. I welcome you now into the conversation, taking into consideration that firstly, you've welcomed the report, and this is part of why we get to be in your presence today. But the question is, how is South Africa practically taking forward some of the findings of this report as G20 chair and also domestically? And then, of course, Minister, there's been a lot of reference to NHI at different points in the conversation. Perhaps you might comment on how some of the findings also align with the National Health Insurance. Over to you, Minister.
Thank you very much, Nozipo. Look, we welcome the report because this report here today, which is being unveiled today, it talks South Africa. It is us, it's looking at us like this. You know, when I saw the picture in front of this report, I thought this is South Africa. Yes, because it looks eerily like it. I've just heard from Mama Winnie here that it is Lima in Peru.
Oh.
But this is Alexander and Santen.
Let's see if we can hold it up
Yes.
for the camera. There we go.
This is Alexander and Santen. So we are not necessarily the poorest country on this continent, but we are certainly the most unequal in all respects. We're the most unequal country in the whole world. And if you want to come to see that inequality, you come to the Department of Health. There's no aspect of South African life that expresses that inequality. So for us, it was not rocket science to know what we want to tell the world for our G20 presidents. It was not rocket science. It was very clear. Everything was laid clear in front of us. You know, those people, some few years ago, during apartheid, South Africa had 14 healthcare systems with 14 ministers of health. I want to remind people about that, with 14 ministers of health, each for each racial group, white, Indian, colored, African. And then, yes, 14. And then there were 10 others, which represent each ethnic African group, because there were 10 homelands. We then get the new constitution. Mandela becomes our president. We all happy. We abolish all that in law, in the constitution. But we are waking up today to find ourselves having two healthcare systems that are brutally different this time around. One healthcare system for the rich, the other for the poor. We have got a healthcare system in this country, which is like any you can find in Europe for those who have got money. But then we have got the healthcare system for the poor, which you can find in any poorest African country. The healthcare system for the rich caters for only 14% of the population. And the one that is for the poor caters 86% of the population. How is that for inequality?
Sure.
Yes, exactly. Now, people tell us that, no, you are unfair. That's why Professor Stiglitz said there's a huge pushback. I know when you read history, there have been pushback to all countries that implemented universal health coverage. The one I know the most is UK. I read stories about it. What happened? Doctors threatening. I don't think any of them know any pushback that we have got here now in South Africa, where the rich are saying, this must stay the same. Of course, we abolish apartheid, but we can never be equal.
Sure.
That equality must stay. To an extent where they believe the courts of this country, because we are told that we have got the best constitution in the country, but it is believed that that best constitution is going to rule that inequality must continue. unabated. That's why we've got 8 cases in court now fighting against NHI, which is our universal coverage. Now, the funniest thing is this. All the affidavits in court start by saying we accept universal health coverage, but not this NHI. They try their best to split them as 2 different entities. And when you listen to people, they accept the definition of universal health coverage, provided you mention only the first part of the definition.
Yeah.
Everyone has got the right to access to good quality health care. Full stop. We all agree. But as to how you are going to get that, that's where the war starts. Because when you come to the second part, which says, and when you access that health care, you must not suffer financially. That's where the war starts in South Africa. So what we have done, we are going to give the world 5 things in our G20 presidency.
Sure.
First of all, we want a discussion about universal health coverage. And we have lined up, I think, the best panel that we could ever have. Professor Joseph Stiglitz is going to participate in there. The Director General of the World Health Organization, Tedros Ghebreyesus, is going to participate. Professor Robert Yates from the London School of Economics is going to participate, as is the OECD, the Deputy Director, and the Oxfam. They have done studies about this inequality, financialization of health, where healthcare is fast turning into a marketable commodity, which is only available to the rich.
Yeah.
That's what it is. So we're going to be debating that because that's what is happening in South Africa. But the second topic is pandemic,
Yes.
which is related to what we're saying here. The third topic is the health workforce. It will always be unequal under these conditions. I want to give you an example of that. Not very far from here, where we are now, you can walk there. There is a hospital which falls within this rich category. It has got 56 gynecologists. You won't understand what is the significance of that if you are not South African. That number of gynecologists in one hospital is more than the total number of gynecologists in 3 South African provinces.
Combined.
Yes, it's more than in Mpumalanga, in Limpopo, and Northwest provinces, all added together. One private hospital has got more gynecologists than those. And yet, when we say we want to bring an end to that, people rush to court and say, please stop this nonsense. Yes, so we have got pandemic preparedness, we have got human resources. But we also then did not forget the scourge of non-communicable diseases that is coming. Even more than these other pandemics. I will tell you why. It's going to be a bigger pandemic than this. Because with HIV, AIDS, etc., which we've been able to tame, and we tame them by bringing inequality. It didn't happen automatically. When we started the world's biggest HIV counseling, testing, and treatment campaign, there was an argument that we must divide people as South Africa is divided into those with medical aids who are insured,
And those
who
without.
are not insured. And we said, if you fight a pandemic, the moment you divide people according to class, socioeconomic class, you can forget.
Yeah.
So in AIDS, we said, okay, this time around, whether you are a billionaire, a gardener, a domestic worker, you test, we treat you, we cancel you, test, we treat you equally. And we did that. You know what that has done? It dramatically brought down maternal mortality. Yes.
Yeah.
Our maternal mortality was on Mount Everest. It came down dramatically.
Yeah.
Because whether you are a poor woman or a rich woman, you are treated the same. So in NHI, I want to do that for all the diseases, especially the non-communicable ones, where I believe there will never be any donations, like happening with HIV, AIDS, and TB.
Yeah.
And lastly, this local production, innovation and local production, we're going to bring it to the fore. So we are going to say, well, this is us, these are our topics. What are you saying about them? Thank you.
Minister, thank you so very much. Thank you very much, Minister. And there's just so much more we could have further unpacked in what you've shared with us, but I certainly think it gives us all pause to realize that this health security and real health security is firmly on the agenda of the G20, and that's reflective not only in the conversations, but the voices that you're bringing in and the way in which the conversation has been framed. Thank you for the history lesson as well, from 14 ministers of health, if one can believe it, to the current system we have today. Unfortunately, we've completely run out of time. The only thing that's left for me to say is to first thank all the speakers, those who joined us in the room in Johannesburg, and of course, those who joined us online as well. To thank UNAIDS, the Global Council, and the Mail and Guardian for making this conversation a possibility. My name is Nozipho Shabalala. Until next time.